How do PET court MRI scans guide lymphoma biopsies? Imagine trying to find a tiny needle in a huge haystack. That's similar to locating the best spot to biopsy when diagnosing lymphoma. Medical imaging tools like PET, court, and MRI scans are essential in guiding doctors to the right tissue for diagnosis. They help pinpoint where the disease is most active and where a biopsy will give the clearest answer. Positron emission tomography combined with computed tomography, or PET court scans, are especially powerful. PET scans use a special radioactive sugar called FDG that is absorbed by active lymphoma cells. These cells use more sugar than normal cells, so they show up as bright spots on the scan. The court part provides detailed images of the body's internal structures. When combined, PET court scans can show exactly where the lymphoma is most metabolically active, even if the lymph nodes are not enlarged. This means doctors can identify small or hidden areas of disease that might be missed on a regular court scan alone. This is important because sometimes lymphoma spreads beyond the lymph nodes into organs like the liver, spleen, or bone marrow. PET court can detect these extranodal sites, guiding the biopsy to the most representative and informative location. Choosing the right site for biopsy is crucial because it increases the chances of getting a tissue sample that accurately reflects the disease. It also helps in understanding how aggressive the lymphoma might be or if it has transformed into a more dangerous form. While PET court is often the first step, court scans alone can also help, especially in identifying enlarged lymph nodes. However, they relying mainly on size, which can sometimes be misleading. Small nodes can still be involved, and large nodes might not be active. That's why PET court is preferred for guiding biopsies. Magnetic resonance imaging, or MRI, is less common for routine lymphoma staging but can be very useful in specific cases. For example, if the lymphoma involves the brain, spinal cord, or deep bones, MRI provides excellent soft tissue detail without radiation exposure. It can help visualize these areas clearly and guide biopsies when other imaging methods are limited. However, MRI does not show metabolic activity like PET does, so it's usually an adjunct rather than the primary tool for guiding lymphoma biopsies. The process typically starts with a PET court scan to assess the entire body and identify the most active disease sites. The images are reviewed carefully to select accessible areas with high FDG uptake, indicating active lymphoma. Then, doctors use the detailed anatomy from court or MRI to plan the safest and most effective way to reach the target tissue. The actual biopsy is often performed with image guidance, usually using court to precisely target the chosen site. This approach ensures that the tissue sample is as representative as possible of the disease, leading to a more accurate diagnosis. In summary, PET court scans are invaluable for guiding lymphoma biopsies because they reveal the most metabolically active and diagnostically useful sites beyond what size alone can show. MRI can be helpful in specific situations, especially when detailed soft tissue imaging is needed. Combining these imaging techniques allows doctors to perform more accurate, targeted biopsies, which are essential for proper diagnosis, staging, and treatment planning. Always remember, if you or someone you know is undergoing evaluation for lymphoma, consulting with a healthcare professional is the best step to understand the most appropriate imaging and biopsy strategies tailored to individual cases.